Dental implants can offer a permanent solution for missing and failing teeth. Doctors Jody Clements and Wade Pierce are here with ClearChoice Dental Implant Center in Salt Lake to talk about the process, including a personalized treatment plan in this sponsored segment. Welcome, doctors. Happy to have you.
Happy to be here. Thank you.
This is truly a life-changing experience, and I got to see this firsthand with my dad, who went through it when he had to replace all of his teeth. I think people get confused sometimes with what we're talking about. They say, do you mean veneers? No, not veneers. What is the dental implant all about, Jody?
It's about replacing all of your teeth. If you're a candidate, it's replacing all your teeth with implants and prosthetics.
The statistics are pretty startling. So 36 million people in the U.S. missing all of their teeth. Another 120 million missing at least one tooth. So why is it so important that we pay attention to any little change, any pain in our mouth?
There are 120 different diseases that originate from the mouth, the most prevalent being periodontal disease. And with periodontal disease, we are losing the supporting structures around our teeth. That's the bone, the tissue, and so you can start to experience things like pain upon chewing, mobility of our teeth. People even experience teeth coming out. And so the important part is to, as soon as you start to feel any of these symptoms, is to be seen, because once this disease progresses past the early stages, it can't be reversed.
Doctor, let's also bring you in. You are doing that surgery. So this is teeth that are already existing, broken, failing, being extracted, and then new implants going in. What is that process like?
Well, you know, if a lot of the people that come in are missing some or all of their teeth, so we have to remove the teeth and replace them with implants, upper and lower, and put in the bridges, and it's done in that day. They're very happy.
Look at the screen right now. That's the before and the after. It's truly incredible.
It's amazing.
What is it like for the patient, not only physically, but mentally and emotionally? I know that when you can't feel confident in your smile, it changes your whole demeanor.
Everything. I saw a lady this week, and I said, how have you been? It's been 10 days since her surgery, and she said, I went outside. I went out in public. And so, I mean, things that a lot of us don't even think about. She smiled, she was out there, she had that confidence, and to give that back to somebody is incredible.
It really is such a gift, and it changes, I think, the quality of their life,
absolutely.
The way they're able to chew and then just exist out in the public.
Yes.
Why is ClearChoice unique, and why is the personalized treatment plan the way to go?
Well, we can say that ClearChoice is the only dental implant provider with proven documented results. There was recently a study done with 18,000 different patients across the country, and there was huge, astounding results, like we already talked about, quality of life, chewing performance, increased confidence, that these people got by going the ClearChoice way of treating their mouth.
Yeah, the before and afters.
Really focus on the needs of the patient from the very beginning, the initial consult, the smile design process, the technology that we use. And then, some differences in ours, and the ClearChoice way is the surgical process and the healing process. We really focus on that, and it's, as Dr. Clements mentioned, it's been proven through 20 plus years of research and amazing patient outcomes.
Yeah, and that's what I wanted to ask you too, the process, the healing. What kind of a time frame are we looking at spending from start to completion of the new smile?
It's a process. It's a process, and anybody that says otherwise is kidding themselves. The healing, fitting, adaptation stage is absolutely crucial to this whole process. And we notice other providers are trying to bypass it just to speed up the process and appeal to people. But the teeth that we put in the day of surgery are not going to fit to the tissue in 4 months. They're absolutely not, because you have to heal. And so we're not interested in being the fastest, we're interested in being the best and doing the treatment that is backed with years of clinical scientific evidence.
Well, that sounds comforting to me, knowing that you are in the best hands. There's no rushing. You are tailoring it to that specific person's need. So anyone right now, if you have a question, you have some tooth pain, you have any of these issues, you can get a free consultation at ClearChoice.
Absolutely, yes. Come in. We would love to meet with you, talk to you about the challenges you're having, the vision, the outcomes you'd like to receive, and take a scan and make sure that we know you're a good candidate for for the treatment.
Yeah, you two are wonderful. You have all of the knowledge. You can help. Don't wait, right? Come in
Don't
now.
wait.
Yeah, we see a lot of patients that are missing a lot of teeth, are very self-conscious or embarrassed, and they don't need to be. It's a very non-judgmental atmosphere at ClearChoice, and our goal is to just make sure they not only regain their dental function but also their confidence.
Absolutely.
It's very rewarding.
Absolutely. Thank you both so much for
Thanks
being
for
here.
having us.
All right. Thank you to ClearChoice Dental for this sponsored segment.